The truth is our priority.
We give justice for your curiosity. Only here on NCC News Today. Live from the summer capital of the Philippines, Baguio City. This is the NCC News Today. It's 8 in the evening, January 7, 2003.
The Globe's latest news. I am Hamsley Saroy.
The country's hottest and sizzling issues. I am Clarence Bacani.
Giving you the truth,
Nothing but the truth. No bias, just news. And for the latest, hottest, and unbiased news for today,
here is the rundown of the top stories at this hour.
SARS, an outbreak of the first pandemic of the 21st century.
Breaking the cycle of infection, can it be possible?
Bats as origin of SARS-CoV.
Diagnostic findings reveal confirmation of SARS-CoV-1.
SARS-CoV-1 patients cared differently depending on severity.
More details coming up after a short break.
Here are ways to prevent SARS-CoV-1.
Ach! Ach! Cover your mouth when sneezing. Ach! Keep a safe distance. Wear a face mask. Always bring alcohol.
Sige.
We are back and you're still tuning in NCC News Today. To begin with, for the description and etiology of the disease. SARS, an outbreak of the first pandemic of the 21st century. Clarence, please give us an update.
The World Health Organization, or WHO, is issuing a global warning about the appearance of a newly recognized type of pneumonia. This is called severe acute respiratory syndrome, or SARS, which is a viral respiratory illness caused by coronavirus, called SARS-associated coronavirus. This disease was first recognized in China, occurred on November 16 of 2002, with second generations of cases erupting quickly in Hong Kong, Vietnam, and over 17 other countries in a number of weeks. SARS is an influenza-like disease with presenting symptoms of fever and cough. SARS develops in people who either have close contact with a person who has been diagnosed with a disease or history of travel or residence in an area with no case. The SARS-associated coronavirus is transmitted via respiratory droplets when an infected person coughs or sneezes. The droplets may be deposited on the mucous membranes, which are the mouth, eyes, and nose of a nearby person. The virus may also be spread when a person touches a surface or an object contaminated by the droplets and then touches his or her mucous membranes. Moreover, the virus may be transmitted in other ways, including sewage and water. But these methods of transmission are unclear at this time.
Thank you, Clarence, for the chain of infection. Breaking the cycle of infection, can it be possible? We have Giselle Vicente giving us the info.
For the prevention and control of infection, we need to understand how the SARS spreads through the chain of infection. There are 6 parts of this chain of infection. First is the infectious agent. This is the ability to cause disease. The type of microorganism that causes infection is virus. We can break this link if we seek prompt treatment if we are ill or have symptoms of SARS, which are fever and cough. Second is the reservoir. This is where the pathogens can reproduce. It can be in a person, animal, substance, or location that provides nourishment for microorganisms. We can break this link by washing our hands properly. We can also follow the WHO steps on hand washing, keeping our environment clean and by disinfecting. Third is the portal of exit. This is how the pathogens leave the reservoir by sneezing or coughing. Fourth is the mode of transmission. This is how the pathogens occur from one place to another. SARS can be transmitted via respiratory droplets when a person who is infected by SARS through coughing and sneezing. The droplets can also enter through our mouth, eyes, and nose by not having a distance to a person who has SARS. Fifth is the portal of entry. This is how the pathogens enter our body. SARS enters through our respiratory tract and mucous membrane. Sixth is the susceptible host. This is when a person who cannot defend against pathogens. Who is at risk of SARS? First is the one who has heart or lung conditions. Second is the one who has weak immune system, diabetes, and elders. We must follow rules so that we can get infected by this SARS that's emerging in our country today. This is Giselle Ann Vicente reporting. Back to you, Clarence.
Thank you. For the pathophysiology of the disease, but as origin of the SARS-CoV-1, Naomi Bolwa has this report.
This is Naomi Bolwa live reporting from the studio. SARS is caused by coronavirus, a type of virus usually associated with pneumonia and the common cold in humans. The virus, however, was proved to come from bats and palm cives in southern China, and once contracted by humans, it will be very difficult to contain since SARS is an airborne virus, which means it can spread in a rapid and easy way. To start with, bats were the main source and civet cats were the intermediate host. In China, palm cives are eaten as delicacy. So this outbreak began from the ingestion of civets which tested positive for SARS. So once the humans were infected, it easily spread through socialization since it can be passed through coughs, colds, and through droplets. With that, there is an invasion of the upper respiratory tract causing now dry cough, fever, chills, headache, and body ache. There would also be now an invasion of the lower respiratory tract causing infection of bronchial and alveolar epithelial cells. It would cause the infection of immune cells and dissemination to other organs that would now cause depletion of immune cells, causing severe lung injury and inflammation. It can also cause collapse of the alveoli, which can lead to insufficient interferon response and excessive secretions of chemokines and cytokines of the innate immune system. Another result of collapse of the alveoli is stimulation of the adaptive immune system, all which results in excessive recruitment of immune cells, also contributing to severe lung injury. The collapse of alveoli can also cause the ACE2 to have downregulation, also leading to severe lung injury and inflammation. The infection of bronchial and alveolar epithelial cells also causes direct viral cytopathic effect, including induction of apoptosis leading to necrosis, sloughing of pneumocytes in alveolar spaces, formation of hyaline membranes that causes alveolar damage, and inflammation of interstitial pulmonary issues that leads to impaired gas exchange and hypoxemia. That would be all. Once again, this is Naomi Bolwa reporting. Back to you, Hamsley Sarah.
Thank you. For the clinical manifestations and diagnostic findings. Diagnostic findings reveal confirmation of SARS-CoV-1. Abigail Abad, please give us the details.
Good day everyone, this is Abigail Abad reporting for NCC News. For today, we will now interview Dr. Rojo to discuss the diagnosis and the clinical manifestation of SARS. The government now classified SARS as an infectious disease and announced a home isolation measures. During that time, clinical manifestations were already identified.
So there is this typical pneumonia-like symptoms, but as a health professional, it's still hard to confirm because it's highly contagious. Health professionals are working out methods in diagnosing the infection.
So doctors were facing an unknown disease, and there is a current data to base this diagnosis. And it took a long time to work out how to confirm the SARS infection.
So every doctors in clinical practice, we only rely with our experience, but none of us have experience with a disease like this because it's a new disease for us. Then there are many instances in which there is no way to decide anything. So on the patient's report, we added an option indicating a possible infection. Actually, it was a Monday morning together with my colleagues after getting a tissue sample and looking at the cells that had been inoculated. In this case, with the lung biopsy of one of the patients, we saw something that is different. The cells were teeming with hundreds of virus particles. What we saw is actually that cells are dying.
It was stated that SARS was literally eating through a patient's lung.
After undergoing with an X-ray, the patients who have suspected to have SARS, we saw that their lungs are not uniform, but patchy infiltrates are commonly observed.
After the outbreak, this 2003 diagnostic test to detect the disease were developed.
So the diagnosis of SARS-CoV infection can be established by a combination of one or more of the following. First is the RT-PCR, detection of viral RNA in clinical samples. Next is the growth of the virus in cell culture, or serologic detection of specific antibody to SARS-CoV. Practically speaking, for most laboratories, diagnostic tests are restricted to RT-PCR, and serology, since viral culture can only be performed in a biosafety level 3 facility. So our reverse transcription polymerase chain reaction, or RT-PCR test, can detect SARS-CoV in clinical specimens such as blood, stool, and nasal secretions. Another test, which is the serological testing, also can be performed to detect SARS-CoV antibodies produced after infection. A serologic test is a laboratory method for detecting the presence and level of antibodies to an infectious agent in serum from a person. Antibodies are substances made by the body's immune system to fight a specific infection. And also, viral culture has been used to detect SARS-CoV. For a viral culture, a small sample of tissue or fluid that may be infected is placed in a container along with cells in which the virus can grow. If the virus grows in the culture, it will cause changes in the cells that can be seen under a microscope.
Other than the diagnostic test, clinical manifestations to suspect SARS were also identified.
So our very first patient that we have admitted at the ER presented with a cough and high fever. And after being admitted, patients developed breathing difficulties and were then transferred to intensive care. It was something that I and the other doctors had never seen before. Not only did the patients deteriorate fast, less than 1 week later, their close contact was hospitalized too. After cases raised in numbers, every hospital was alarmed because of the unusual number of cases with the same symptoms. The first symptom of the illness is generally fever, which is higher than 38 degrees Celsius, which is often high and sometimes associated with chills and weakness. It may also be accompanied by other symptoms including headache, malaise, and muscle pain. At the onset of the illness, some cases have mild respiratory symptoms. This is typically rash, and neurologic or gastrointestinal findings are absent. Although a few patients have reported diarrhea during the early febrile stage, after 3 days, a lower respiratory phase begins with the onset of a dry, non-productive cough or shortness of breath that may be accompanied by or progress to hypoxemia. Hypoxemia, which is low blood oxygen levels. In 10 to 20% of cases, the respiratory illness is severe and often require intubation and mechanical ventilation. Chest radiographs may be normal throughout the course of the illness, though not for all patients.
Updates about the disease were already available. Incubation period for the disease is identified.
So usually the incubation period of SARS is 2 to 7 days, but maybe as long as 10 days.
After this case has begun to spread uncontrollably from China, Canada, Taiwan, Vietnam, and other parts of Asia, this 2003 was really a challenge, especially here in Asia, just to find ways to stop and prevent the spread of SARS. Lockdown was implemented and gently hospitals in China. Because of the lockdown on its own, and the battle of SARS was only the beginning. This is Abigail Abad reporting for NCC News. Back to studio.
Thank you. For the medical and nursing intervention, SARS-CoV-1, patients care differently depending on severity. G. Sapalin, serve as what you've got.
Healthcare professionals explain the procedures for treating moderate conditions, including instructing patients on good coughing and deep breathing techniques, encouraging them to drink more fluids and explaining the negative effects of smoking and secondhand smoke on their health. In case of critical patients, interventions consist of administering prescription medications such as antibiotics, mucolytics, bronchodilators, and expectorants. As reported, they work to keep the appropriate level of humidified oxygen. If the patient's cough was ineffective, they perform nasotracheal suctioning if necessary. These are the care rendered to patients with mild severe cases. This is Jessa Palong reporting. Back to you, Hamsley Sari.
For the recap of today's hottest news,
SARS, an outbreak of the first pandemic of the 21st century.
breaking the cycle of infection, can it be possible?
Bats as origin of SARS-CoV-1.
Diagnostic findings reveal confirmation of SARS-CoV-1.
SARS-CoV-1, patients care differently depending on severity. So that's all the recap. So if you have questions, please text us on our official number 0935-9665. Okay, and that's all for the updates for this night. I am Clarence Bacani,
And I am Hamsley Saroy,
giving you the truth, nothing but the truth. No bias, just news. This is NCC News Today. Good night!